Go.
Well, here's a typical adult flat foot. We're gonna take a look at this flexible adult flat foot. So I go ahead and I manipulate the foot right here. It's supposed to stop right about here, but once I let go, it pronates, it flattens out. As you can see, this arch is flat. I'm gonna take a foot model, take a look at this. This is what that foot looks like with the bones. So this is flattened out. This protuberance right about here, it's on the bottom. This bone is called the navicular. This is the talus. This is hitting the ground right about here. Sometimes patients complain about pain from here to here. There's also a tendon called posterior tendon that runs behind the ankle, runs into the navicular bone, right along here. I'm drawing it right now. That could be stretched out over time. That's probably what's happening with this patient right here. A little stretched Achilles tendon, a little posterior tendon, not Achilles tendon. Posterior tendon is stretched. So again, this is a typical. For a normal foot, it should lock right about here. Okay, that's a nice arch, flexible flat foot with an arch. But with a flat foot, it goes down and it flattens out the way it does right now. So you can see the arch here is very flat, and the footprint is the whole foot on the bottom. There's not a nice arch that you normally see. Showing it on the flexible foot model, this is what's happening. I'll show it on this foot right here. Going out, flattening out right now. So showing it on this foot model here, all the joints of the foot react together. So what's happening with people with flat feet, this joint dislocates right about here. Right about here, it goes down, dislocates. So there's a regular foot, there's a flat foot right there. So you can see the navicular and the talus goes down into the ground, and that can cause a lot of pain. Some people have calluses right underneath here if they have an extra piece of bone called an os tibialis externum, or a Kidner's foot, Kidner. But basically, this is a normal arch. There's a flat arch, and you can see everything is rotated, and sometimes you can see the knees pointing straight into the midline of the body. That's how you can see that sometimes in patients. So this is an adult-acquired flat foot. Now, what do we do about it? For people with that are not asymptomatic, we could go ahead and cast them in orthotics. Cast them in orthotics, that way you'll hold the foot in the position while she's walking, so she does not pronate and put too much pressure on the muscles here and put too much stretch on this tendon. It's already stretched already, so she won't stretch it out anymore. Conservatively, that is the #1 treatment right now for flexible flat foot. Other treatments, if you start having symptoms and pain that prohibits you from doing activities, even beyond orthotic therapy, this is a nice little device that we have available with 94% acceptance rate. Now again, let's go over the mechanics. When I do this, it flattens. But watch, there's an implant I put in from the side. I'll show from the other angle shortly. There's an implant we put in surgery. Exaggerating. It's almost the shape of a pen. It's conical in nature. It's a cone. So when you put it in, it does not allow this joint to go down. It does not flatten. So we're going to show from the other angle now. We're going to cross on this side. I'm going to show it from this angle. Again, this is before the flattening and the arch flattening out, and that's how you normally see a person's foot. They're going out this way. Sometimes they get made fun of for walking like a duck. So now, surgically, what we can do, minimally invasive wise, we have a couple of different procedures. An easy procedure will be to get an implant into this joint and lift it up. As you can see, it acts like a stop. So this way, even if I try to flatten, I can't. This acts like a stop. There's an actual implant we put in there from different companies. This is the joint called the Subtalar Joint. You see the shape over here. There's a little cave in here. The implant goes right in, screws in there, and it stays in there, it locks in. So that way it does not flatten. As you can see, I'm pushing that bone down, it does not flatten. This implant or device is preventing it from flattening out. Another way of treating this is called a calcaneal osteotomy, Evans calcaneal osteotomy, where you actually place a cut on this bone right here, put a little bone wedge, and with that bone wedge, it actually goes, instead of flattening out like this now, the bone wedge is going to force the foot over. There you go, there's the arch. The arch is reformed again. If Claudio goes on the other side slowly, and you see that the arch is formed again. Now, we're going to show that first we have the implant holding it up. That's one way of holding it up. The other way, when people with flat feet, your foot like flat like that. I put a bone wedge on the outside of the foot. Everything comes back together again, and the arch is remade. Now these are two most common ways to fix adult acquired flat foot, or three, the orthotics, but surgically the two most common ways of dealing with adult acquired flat foot. One by the implant, the other way with the bone graft on the side, bringing the whole foot back over again. As you can see, with how the joints align in your foot, once I put the bone graft in there, not only does it bring your foot back in, but the arch is remade just because of the shape of the intimate nature of the joints in the foot. More advanced, more intrusive procedures are available where we fuse these joints right here, 1, 2, and 3, but that's usually for people with advanced degenerative disease, more advanced degenerative disease. But for younger patients and active patients, typically the joint implant or the osteotomy of the heel bone right here, called the Evans, EVAN apostrophe S, typically works. The implant holding it up, or the bone wedge, taking a flat foot, swinging the leg back over, the foot back over underneath the leg again, and giving you that that arch. Now I have a very popular blog that talks about that. You can read that, see some pre and post-op x-rays, and hopefully this video will give you a good insight about adult acquired flat foot with the foot model, as well as give you a idea of how adult acquired flat foot happens. From here, a normal foot to a flat foot. And there's many ways to fix this. It all depends on the experience of your surgeon, the type of procedure he or she has done, and their experience with dealing with adult acquired flat foot. Make sure you seek out a board qualified or certified RearFoot and ankle surgeon for this. This is a very specialized procedure. So, any questions? Let me know.
Go.
This continuation of the flat foot video, just to explain, be more comprehensive about this situation where I see very common in the practice of family foot and leg center in Naples, Florida. This posterior tibial tendon dysfunction is what usually causes an adult acquired flat foot or posterior tibial tendon dysfunction. Usually adults with flat feet have a problem with this posterior tibial tendon right here, posterior tibial tendon. This inserts into the bone called the navicular right about here. Again, I pointed it out in the last video. This is the navicular bone. This posterior tibial tendon runs right around, under, and into this tendon. A lot of time, flat foot reconstruction will require the surgeon to fix or shorten this tendon, or increase the strength of this tendon, either by shortening the tendon or by transferring the tendon right behind it, called the flexor tendon, forward, to give the tendon extra strength. The reason why this is important for people with flat feet is that this tendon itself is solely responsible for maintaining that arch. If the ligaments are very weak in the foot, this tendon will take on extra stress. If this tendon takes extra stress, it can tear. It can also become degenerated, where it won't function as it's supposed to, and this will not work properly. A lot of times, the way we check for a dysfunction of this, number one, there's pain along the tendon. Put my hands along this on the patient, and it's very painful. The other way I can check, it's called a single heel raise test, and I'll show you. If you look at my foot, I'll have a patient stand right about here, put one foot behind the other, and I'm gonna have them stand. Raise on the ball of your feet. Typically, a patient with posterior tibial tendon dysfunction will have very hard time doing this compared to the other foot. Will be very normal. Now, patient with posterior tibial tendon dysfunction will have a very hard time doing this maneuver. Okay, so that's another quick way to test. So two ways to test. I put my finger along this path of the tendon here. The other way is do the single heel raise test. If patients fail that, an MRI is necessary. We do casting, we do bracing. Depending on severity of your condition, various treatments are available. Again, we went over the surgical interventions for that, how we fix that either with an implant or with a bone graft to swing the leg over, or even something called a triple orthodesis, where we fuse the joints in the hind foot in order to realign the patient's flat foot. This map right here, this picture actually shows how a person with flat feet will look from behind. Also, if your heel starts turning out like this, outward like this, that's a very bad sign. That tendon is usually very severely compromised, and surgery for your feet and ankle is more likely than not. So the main thing is with this kind of deformity is you want to catch this thing early. You don't want to wait. You want to catch it when it's in the inflammatory stage of the tendon rather than the collapse or degenerative stage of the tendon. So any questions with this, you should see your podiatrist as soon as possible, and make sure your podiatrist is comfortable and familiar with treating adult flat foot, and they're certified and qualified to treat this condition for you.